Hello, I'm Jill Hart, Business Development Manager at KBL Solicitors. Thank you for tuning into our employment law vlogs, which have been recorded by Sarah Collier, KBL's Head of Employment Law, and Anna Reddy from Leap Health. Sarah is a highly experienced solicitor, specialising in guiding and advising businesses and individuals through the complexities of employment law to achieve the best possible resolution. Anna's area of specialism is optimising productivity and performance, putting health at the heart of everything we do. In this series, we've recorded 3 vlogs looking at issues in the workplace and their impact on employers and employees alike. The first vlog covers menopause, the symptoms, statistics, awareness in the workplace, what to be aware of and practical steps you can take. Second, we take a look at mental health, how employers can support employees, what to look out for, how we can help ourselves and a few tips on what others can do. Lastly, we discuss hybrid working, the benefits and challenges to employees and employers, along with how businesses can support those working from home. Thank you. I'll now hand over to Sarah and Anna.
So today's session we'll be talking about mental health in the workplace, both from a legal standpoint and also purely from a health perspective. We are going to examine what is mental health, what as employers you can do about it in the workplace, what kind of support you can provide, and what are the legal implications for individuals in the workplace that might be suffering from mental health. Also, hopefully giving you some tips on things that you can do to provide early intervention for employees that might be suffering from various mental health conditions or situational mental health. So should we start off with you giving us a bit of an idea of a definition of what actually is mental health, Anna?
Well, mental health is emotional, psychological and social well-being. It's not necessarily though mental illness. We all have mental health, and it's how we manage this and support ourselves through different situations or environments that we're in, or maybe genetic conditions that we've got that can cause different mental health situations. So mental health is really vast. It can come in all different forms. It can be depression, it can be anxiety, it could be bipolar, it can be OCD, it can be post-traumatic stress disorder, body dysmorphia, many different things. But in the last few years we really have seen a dramatic spike, really in terms of the things that are impacting our environment, such as COVID, such as other things that are going on in the world that can really impact on the way that we feel. So that in essence is really what mental health is all about. So can you tell us a little bit more about how we're protected in the workplace from a legal stance?
Yeah, so employers have a general duty upon them to protect, as far as is reasonably practicable, to protect the health and safety and welfare of their employees at work. And mental health is no different to physical health in that regard. So there is this duty for employers to ensure that the health, including the mental health of their workforce, is taken care of. But in addition to that, we have legal protection for individuals that are suffering from mental health conditions or mental health generally that can amount to a disability. So the law provides a definition for disability, what an individual who is disabled, and basically that is where an individual or an employee has a physical or a mental impairment that substantially is impacted in an adverse way on their day-to-day activities, and that condition is long-term. Usually what we mean by long-term is either it has been going on for, or is likely to last, or has lasted for more than 12 months. So basically, in order to determine if someone's mental health condition is a disability under the Equality Act, you're looking at each angle of that definition, and ultimately it will be decided by a tribunal. So employers have to be careful. It's very difficult to decide whether an individual is disabled, and they need to get advice where necessary to ensure that they know where employees may be considered to be disabled under the Equality Act, and that they put the appropriate measures in place, such as making adjustments for those individuals. What can they do to support them and reduce that disadvantage they suffer because of their mental health condition, and to ensure that they're not discriminating against those people because of their mental health in any way. So that requirement on employers to ensure that there is no discrimination in the workplace starts from recruitment all the way through to an employee having left an organisation in that life cycle of employment. So there is a lot that the law does to protect those that have mental health in the workplace.
So just to dig a little bit deeper in terms of that, would an employee have to actually have a clinical diagnosis of a mental illness to be classed as disabled?
Absolutely not. So, it doesn't matter whether there is a clinical diagnosis for any disability, whether that's physical or mental health. It's simply whether each aspect of that definition is met. So, is it a mental impairment? Is it likely to, or has it lasted 12 months or more? Is it having a detrimental impact on their ability to do day-to-day activities? And that's substantial. And if all of those things are ticked and are met, then absolutely they could be classed as disabled without any clinical diagnosis at all.
Great, thank you for confirming that. So let's dig a little bit deeper again to look at what we can actually do to support employees in the workplace.
So from my perspective, and what I would often advise clients to do where they have somebody that is suffering from mental health, is to actually, it's very difficult often for an employer who might not have the knowledge of that particular condition or that particular illness to understand it and to know what they need to do to support an employee. So the starting point for employers is often to get a report from an occupational health advisor who is independent, who can either meet face to face or conduct some kind of assessment of the employee, and can actually provide a report. So what is the condition? Are they suffering from it? What can the employer do to support it, and what should they be doing to support it? And that will often be a great starting point for employers to know what adjustments they should and could put in place for an employee. So occupational health can be really helpful for employers to get information on a condition, for somebody who is clinical, who understands them conditions, to give information to the employer and take into account the workplace and the employee. So that would be one starting point. Lots of employers and many of my clients have employee assistance programs, so they can often provide support, counselling or therapy or other aspects of support to individuals going through any type of mental health or illness or condition that they're suffering from. Counselling can help often if there is a particular mental health situation. So, for example, many of my clients will refer their employees to the employee assistance programme if they are suffering from bereavement or going through some kind of situational type of mental health issues that they need someone to talk to. I think it can be quite difficult though, because I think some employees are slightly sceptical that this information isn't passed back from the therapist or the counsellor or whoever it is that's providing that assistance to their employer. And these are often very sensitive, highly sensitive and confidential issues that employees might not want to share with their colleagues, might not be comfortable with all of that. So they do have their place, but often they can, depending on the employee, there might not be that engagement necessarily. I think again another thing that an employer can do is look at champions of first aid, first aiders in the workplace, and putting people through training to be able to be there as a first port of call for anyone that needs that help, that support, and to give somebody somewhere to go to open up those discussions on mental health. Do you have any pieces of advice for employers in terms of lifestyle interventions that they could look at in these types of situations?
Yeah, definitely. I think following on from the mental health first aiders that you mentioned, which I think are a really, really important role within the organisation, as you said, as that first port of call for just directing them to the right person to speak to next. That kind of skimmed the surface around lifestyle interventions, and I think there's a big piece there that needs to happen, because there's so many things that we can do through small healthy steps to support our mental health that sometimes are overlooked really. I often refer to the READY acronym, which is R for rest, E for what you eat, A for activity, D for distractions, and Y for you. It's all about your world. So you know, a lot of mental health is impacted by the way we sleep and the way we rest. And in a really, really busy world and, you know, demanding world that we're in right now, often we fail to do that, and that is at the detriment of our mental health. So, you know, we can really support ourselves by having that good sleep routine, supporting our sleep hygiene, and really prioritising our rest and recovery. All these lifestyle interventions are little things that you can do if you do have a clinical diagnosis and you are on medication. It's not a substitute for medication without a healthcare professional's advice. But yeah, moving on from R, which is rest, recovery and recharge, then go on to what you eat. And there's so much evidence now to support that how you know, what you eat does impact on your brain health and the way that you feel. So really focus on fueling your mind to support you support yourself. So, you know, things such as your vitamin D, evidence to show that it improves your mental health, B12, omega-3s, lots of different things that you can really do to support your brain health. Then think about, you know, how you move as well. Movement really does raise your mood, and it's not just about slogging it out in the gym for an hour. It's just about finding little pockets of time just to move and taking a step back to find out what are those triggers that can actually make you move. Because, you know, 9 times out of 10 no one can be bothered to move, but 10 times out of 10 at the end of the workout or just a little bit of movement, you do feel better. And then think about distractions, which is just bonkers in the world that we're in right now. There is so many distractions, and a lot of those not having a good impact on our mental health. So think about your social media, think about your screen time, you know, think about the people that surround you. Do they make you feel good? Do they support you? And on the flip side of that, think about positive distractions. Think about those positive people around you that you can connect with, because loneliness is a massive thing as well that we need to address. Just try and connect with those people that are a positive distraction in your life and people that you can open up to and talk to. And then why is that it's all about you. So think about your world, as Sarah alluded to earlier, and it might just be a period of something that's happening within your life right now that's just in your world that is impacting on your mental health. So don't compare it to anybody else, and really trying to find the solution that's specific to you. So that is, you know, a quick acronym to go to that anyone can check in with and try and pinpoint some small little things that you can do to help your mental health at any point. So I hope that's useful.
Absolutely.
Have you got any more to add to that, Sarah?
Yeah, I think workplace culture is huge, and I think the aim for employers, and certainly we'll come on to see that there are lots of other advocates for this, is creating a culture that is open, that is encouraging people to talk about their mental health, that provides that support for employees. Because at a low level, you know, poor mental health that's not necessarily diagnosed and is not a clinical aspect, and it might be situational, can just be assisted by that support in the workplace. So I think having an open culture where people feel able to talk in the workplace is key to ensuring the positive mental health of your workforce, and getting that work-life balance. You know, in earlier sessions we've talked about hybrid working, that we hear a lot about flexible working, particularly post-COVID, and these are things that can really help people to alleviate their stress, as you say, in such a busy world that we're in. So for me, they are some key things that employers can look at in terms of getting that culture and that work-life balance for their employees. In terms of other aspects, I think from a legal standpoint, it's important to note as an employer that confidentiality of this information you hold about your workforce and their mental health is so sensitive and as I've suggested, confidential. You know, employees can keep information about their health to themselves. They do not have to supply that, but if they do, it is the employer's duty to ensure that that data, that information is kept secure, that it is not spread around the workforce, that somebody's off or somebody's just, you know, received a diagnosis for bipolar, or somebody's going through a divorce or some kind of other bereavement. It's different if the employee shares that themselves and they want to talk about it with colleagues, but I think it's important for employers to really understand the confidential nature of that information. And for example, where you're referring them to occupational health, you have to get their consent to do so. And you know, people can be be very protective of their health information, really. So I think that's an important factor when looking at mental health in the workplace. One thing that we have seen is a little bit of a change, a government paper that has been published on mental health and wellbeing in the workplace, and that's putting in place a 10-year plan to reduce the prevalence, the incidence and the reoccurrence of mental health. And it's calling upon employers to be compassionate and supportive of their staff in these situations, and to promote and protect positive mental health in the workplace. This report talks a lot about a need for a clear role for employers to prevent the onset of mental health in terms of workplace stress, but to also be there for early intervention and to help employees who might not need a clinical intervention as such. So there is currently a consultation ongoing, and the responses to that are going to be collected in July this year. So hopefully we will see this 10-year plan come in place to help give employers guidance. But it is so important for employers to acknowledge, to understand and to be available and supportive to their employees in terms of mental health. Somebody that is suffering with poor mental health is going to be affected in the workplace, there's no doubt. And if they feel supported, not only will that help them in the moment to improve productivity and to be there, but it will also make them look back and think, do you know, at a time of need, at a time when I was going through poor health from a mental health standpoint, my employer was there, and their colleagues will see that support that you're providing. So there are so many benefits to looking at mental health in the workplace and supporting employees through that. Is there anything else that you would add on that?
No, I just to add on to that is that I think we're so fortunate, well, not fortunate for the last few years, but the fortunate things that's come out of it is that our workplace isn't now just our workplace. We're not expected just to leave any of our issues, you know, aside when we step into that work environment. I think more often than not, we can turn up being our whole self rather than just that professional self. And I think there's a little bit more integration and a little bit more acceptance that we are human beings, that we're not some Wonder Woman, you know, Superman that can just switch off when we get into a work environment. And that is a real positive from the last few years that we can take. And I think what else has changed is that health and wellbeing now is a need to do thing. It's imperative, as Sarah just read out that report. This is the future. We have to do it. We can't be reactive to it. Pre-pandemic, it was a nice to do thing maybe, but now we're in a situation where it is a need to do thing. So I would really, really encourage you to take action and put those things in place.
Just to summarise, a couple of things as an employer that you can be doing is ensuring that you've got the right culture that's open in terms of mental health. You can have things like focusing on Mental Health Awareness Week, so that it's encouraging employees to know that you care about their mental health. Put a policy in place to let them know that mental health is important in your workplace, and you want to reduce the stigma of that, and you want them to feel able to come and discuss issues surrounding their mental health with you and put support and adjustments in place, not only because you're legally bound to do that, but because there are so many other positive reasons to put those steps in place, and have the mental health first aiders, the training in place that Anna can come in and carry out to just make everybody aware of it. And I don't think you can go wrong with two things: remembering to be kind to everyone, and also nature always helps my mental health. So lots of employers are doing days out where it gets people away from the workplace, focuses their mind on social interaction, which we've had so little of for such a long period of time, and allows everybody to get together in nature to just turn off from the stresses of life and work. So there's some tips that I would put forward that my employer clients have looked to introduce in their businesses.
Thank you, Sarah. So if anyone wants to find you to maybe put a policy in place or talk a little bit more about the legal aspects, then how can they get in touch with you?
Yeah, you can contact me via my email scollier@kbl.co.uk, and all of my details are on KBL's website. Sarah Collier, and I'm the employment partner and head of employment for KBL solicitors. What about yourself, Anna, in terms of being able to contact you for training and support in the workplace from being able to educate their staff on these issues?
Thank you. Yes, and being able to educate staff on these issues means that they can lead their own journey as well and support themselves as well to be happier and healthy and more productive. So yeah, my website is www.leaphealth.co.uk. My email is anna@leaphealth.co.uk, and as Sarah said, I run workshops, but I also as well focus on increasing the engagement with what you've already got available, such as EAP or working with your mental health first aiders as well. So please do get in touch if you need any more information.